during the age of COVID-19. How is the continent responding to the virus, and what's the outlook for Africa in coming months? To answer this, we are joined now by the World Health Organization's Technical Director for Africa, Mary Stevens. Mary, good evening, and thank you for your time. It does look like the virus has made a soft landfall on the African continent, sparing us the high death toll, but we do have struggling health systems that will not be able to handle the high cases should indeed the virus peak. How is Africa responding?
Yes, Africa, as you can see, in comparison to other regions, it has the least number of cases and the least number of deaths. Countries in Africa started implementing measures early enough. So this early action has helped countries in Africa to slow down the progression, in addition to implementation of the public health measures of early detection, testing, isolation, treatment of cases, contact tracing, and preventive measures, including some of the social measures being implemented, has helped the continent to slow down the progression of the outbreak. So for Africa, yes, the response has been commendable. Despite the weakness of our health systems, the countries have managed to slow down widespread outbreak. This is like 3 months into the outbreak. We are still at around 110,000 cases, and up to 40% of our cases have recovered. So it's commendable, the effort that countries in Africa have put in place, and we need to sustain this effort until we get to the end of the outbreak. Yes, if we have explosive outbreak, our health system is weak, and it may not cope with an increasing exponential number of cases. This is the reason why we have to sustain the efforts we have put in place to slow down the progression of the outbreak, to avoid the situation. We have done so well so far for the past 3 months, and let's maintain this and continue to implement these measures. So let's not be complacent. Let's continue with these measures so that we avoid, of course, having a situation where our systems that are already overstretched will get overwhelmed with COVID outbreak.
2.4% of the total cases reported globally. One would say, well, that's a very small number, and therefore this is why Africa, most importantly, is being marginalized in the broader global response. How involved is Africa when we're talking of the response, and how much are they included in this conversation?
Yeah, Africa is very much involved. There is a global solidarity for this response. And I know from the beginning of the outbreak, the Regional Office for Africa has been helping to make sure that there is an equitable access to all the personal protective equipment, to the laboratory testing for people in Africa. So the senior management has been pushing for that access, and so Africa is fully on board in terms of the global response to COVID outbreak.
Now, one of the vulnerabilities that organizations are seeing is the neglect of the other pandemics like TB, HIV, which by estimates, if again the people fall out of their antiretroviral therapy, we could be seeing 500,000 deaths on the other side of at least the next 2 weeks if that is not being taken care of. What other vulnerabilities are you seeing?
Yeah, so this is what we were talking about early on, because Africa has a high burden of other diseases, and our health system is not strong. We have a weak health system, and so if you have an outbreak such as COVID, and the public health measures that are put in place, if they do not succeed in slowing down the progression of the outbreak, what you will see is impact on other health services. So provision of essential health services, including including something as simple as routine immunization, not just treatment of TB or HIV/AIDS. So this is the reason why we need to make sure that, yes, we have very few number of cases, but we need to ensure we have capacity to expand quickly. Peradventure, we have additional number of cases occurring on the region, so that we can still maintain the essential health services while providing support for the COVID patients.
Talking about that upscaling, the CDC in Africa is saying we would need at least 10 million tests to be conducted in the next 4 months. Also, we need 100 million face masks and 25 million ventilators for the continent. Is that an achievable target in your view?
Okay, so now the outbreak on the continent is different from countries to countries. So we have countries with different transmission pattern, and so whatever the kind of needs you have in these countries will differ according to, of course, the kind of transmission pattern you have and the requirement for additional issues like testing, for instance. Countries have different testing strategy. Basically, what countries are doing right now, given the capacities they have, is to do testing of suspected cases, testing of their contacts, and testing of people that they put in quarantine while they're about to exit the quarantine. So we have countries like South Africa, Ghana, and some other countries that have expanded to doing community testing. So now, in addition to the testing capacity, the issues of ventilators, oxygen supply, ICU bed is also one of the challenges we have on the continent. If you look at the global situation, it's not peculiar to Africa. There are shortages even in stronger health system of these ventilators and the issue of ICU bed because of the way the outbreak has evolved in different nations of the world. So now what we can do, we have helped to slow down the progression of the outbreak on the continent. And so governments can continue to sustain this effort, because if you reduce the number of people that are exposed to the virus, you are reducing the number of people that will get infected, and you are automatically reducing the number of people that will require hospital admission, the number of people that will require the ventilators, oxygen therapy, and the ICU beds. So we know that 80% of
that is Mary Stevens, the technical director of the World Health Organization.